Assalamu alaikum. In the name of Allah, the Beneficent, the Merciful. All praise is due to Allah, the Lord of the worlds. We, of course, refer to the one who came to us in person, Master Farad Muhammad. And we thank him for raising from the midst of us the Honorable Elijah Muhammad. And we thank the both of them for their divine reminder in our midst today, the Honorable Minister Louis Farrakhan. So in their names, and in the names of the righteous people, both the living and the dead, I offer the greeting words of peace to you. Assalamu alaikum. So welcome. This is episode 2 of what happened to Minister Farrakhan, the near-death experience explained. And of course, if you were with us for episode number 1, you know that we were dealing with an emergency, bloody scene, massive rectal bleeding in a little community hospital that was pretty ill-equipped to handle such an emergency. So blood everywhere, chaos, confusion. But as Allah would have it, the blood that was needed to stem the loss of vital signs from this bleeding ulcer arrived in time. And so this bloody scene of chaos had a happy ending because we were able to rescue the minister in time, even though there were critical moments where his vital signs had failed and the life had left him. And just like that, due to the Trendelenburg maneuver and the arrival of the blood, we were able to bring him back. And so there was a gap of time. I guess that's what a near-death experience is like, where there's a gap between the heartbeats. So the Quran says, whoever saves a life, it is as though he had saved the lives of all men. And so that's how I feel about it. Now some scholars say that only applies to the messenger of Allah. If you save the life of the messenger of Allah, then that's like you had saved the lives of all men. Well, you interpret that as you will. And so the very next day, we nursed the minister through the night in the ICU, doing the best we could in an ill-equipped community hospital. And by the time the sun came up that next morning, the minister was fully conscious, and I told him what had happened. He was unconscious from the minute I got there at the hospital. He had lost so much blood, he had lost consciousness. So he didn't know what happened. And so I was informing him. And of course, by that time, the family had arrived, and other people had arrived. You're looking at an image of myself and Dr. Masak, Dr. H.N. Masak. Unfortunately, he recently passed away. But he was there the very next morning from Washington, D.C. And of course, I informed him. The actual medical director of the community hospital showed up the next morning. I gave him a full explanation of what had happened. And of course, he was quick to inform me what I already knew, that this little community hospital is not where Minister Farrakhan needed to be. And so we immediately made arrangements, for him to be transferred to a hospital that was equipped enough to handle such a critical case. And because Dr. Masak had flown in from Howard University. Now, Dr. Masak and I go back years. When he was a medical student, I was the chief resident at Harlem Hospital. So he spent part of his 4th year in medical school tagging along with the surgical team at Harlem Hospital. And then I lost track of him. And the next thing I know, he's the chairman of plastic surgery at Howard University Hospital. And of course, he has a strong family background in the Nation of Islam in New Jersey, so we became personal friends, and we did things like go sailing in the Long Island Sound in sailboats, so we did all kinds of adventuresome things. So I was very surprised I didn't know that. I guess somebody informed him that the minister was critically ill, and so there he was the next morning with the rising sun. And so we huddled together and we conferred and we thought about what would be the best thing to do. And we both agreed that the best place to put the minister was at Howard University hospitals. Now, the hard part was convincing the family that that was true, because they wanted to take the minister to University of Chicago hospitals. And I said, well, wait a minute, don't you understand that University of Chicago hospitals are owned by Rockefeller? That's a Rockefeller hospital. And Rockefeller is not a friend of Minister Farrakhan. So I wouldn't trust Minister Farrakhan in the hands of Rockefeller's doctors. And they said, well, what's so great about Howard? I said, because everybody at Howard University hospitals loves Minister Farrakhan. That would be the safest place for him to be in the entire world if he has to be in a hospital. Everybody from the janitor to the top level doctorate administrator, they all love Minister Farrakhan. Everybody in the whole hospital will be on security. Once they know the minister's there, all the nurses are on security now because they all love the minister. The man was mopping the floor. If somebody tried to do something to the minister, he'd use that mop. He know how to use that mop. So the safest, I pointed out to them, say during the Million Man March, do you know 700 doctors from Howard University Hospital volunteered to help me with the medical stations? And I don't know how many nurses, but 700 doctors. So they loved Minister Farrakhan. So that was the convincing argument. So we hired a Lear jet, I think it was, one of those little private jets, an ambulance jet, and flew the minister to Washington, D.C., to Reagan National Airport, and had him brought to Howard University hospitals. And of course, they rolled out the red carpet as much as you can, you know, under those circumstances. You know, and he got first-class service from start to finish of his hospital stay. You know, I mean, I have no criticism of anything that took place concerning Minister Farrakhan's care in the hands of the Howard University hospital staff. The doctors were excellent, the nurses were excellent, the dietitians were excellent, the therapists were excellent. Everybody pitched in, and there was a glow about the hospital during those days, during the stay of the Minister Farrakhan in the hospital. I mean, it was almost like a recapture of the spirit of the Million Man March. The whole hospital was involved. And I'm sure everybody was praying. Everybody was praying. And so I really thank Dr. Massac, and may Allah be pleased with his soul, for doing the arranging, the organizing. Do you know how much it takes to organize what happens and what happened next, you know, in this situation? So let's get some of the basic facts. You know, this is the prostate gland. It's a part of the male reproductive system. And so just so you have a visual of what we're really talking about. And so you see the prostate right there. Where's my pointer? Oh, it's not showing on the screen. Yeah. The prostate is right there. Now see, this is the rectum. So that's how they can do the digital examination. They put the finger right here, and you can feel the prostate through the rectal wall. It's about as thick as a thick piece of paper. So you can, like feeling through a plastic bag. So you can feel the prostate gland, and if there's a tumor or swelling or tenderness, you will be able to detect that by putting your finger to the doctor there. And hopefully he has a glove on. So men are very familiar with that examination, just like women are familiar with their version of a pelvic examination. And if you look at the male reproductive system from the front view, it's not dissimilar to the way the female reproductive system looks. So now, prostate cancer, of different types, different cell types, they're not all the same, are becoming more and more frequent in the population, especially among black men. I mean, if you think about it, you can hardly think of a prominent black man that you know of that doesn't have prostate cancer. And many of the deaths that occur among our leadership, prostate cancer, you see? And there's a reason for that. Prostate cancer in men is related to the polio vaccine with SV40 that they received when they were little boys. And in women, the sudden surge in breast cancer is related to the same cause. That polio vaccine that you got when you were a little girl. And then 35, 40, 50 years later, you have breast cancer in men, cancer in the prostate. And so here's the whole issue. You have a tumor, okay, how do you get rid of that? It causes symptoms, like in this case, it's constricting the urethra, so this man can't pee. His urine stream is very weak, if at all. He might be suffering from urinary retention, which in and of itself is an emergency situation. So in other words, these tumors can cause problems beyond just the usual things that you think about with cancer. And of course, the size of it matters, and the exact location matters. So with any cancer, those are important features. And that has to do with staging. What stage cancer are we dealing with? If it's stage 1, then it's just an isolated small microscopic tumor that hasn't spread. Stage 2 is a little bit bigger and can be felt on the digital examination or picked up on a scan or by other means. By this time you have maybe an elevated PSA examination. This is stage 3, where you see that the tumor pretty much has spread and is in contact with the capsule. See, the prostate gland, like all glands, has a capsule around it, a fibrous capsule that encapsulates it. So if the tumor breaks through, now that's stage 3. And of course, stage 4 is not just through the capsule, but then spreading locally and even metastasis to the bones or the liver or brain or other parts of the body. So stage 4 is incurable. Stage 1, stage 2 are curable. Stage 3, that's iffy, maybe, if everything goes right. And so in the minister's case, I'm not going to show you the actual scans because I don't have them, but it wasn't clear whether we thought he was stage 2, but then at a certain point, it was possible that he had actually a stage 3. There was a period of uncertainty where we weren't sure. And that had a lot to do with the strategy for the seed implantations that people have heard about. So again, this is just the basic anatomy, and I want to point out how close the prostate is to the rectal wall, because the ulcer that was bleeding in the minister that had him almost on his deathbed, in his near-death experience, was because he had a bleeding ulcer right here in this area adjacent to the prostate gland. This is where the seeds had been implanted in his prostate gland, and then the ulcer appeared right here, adjacent to where the prostate had been implanted with radioactive seeds. But let's not get ahead of ourselves. So these are the basic ways of diagnosing prostate cancer. So the minister told me, I'm not sure about the date exactly, but probably around 1998, we were at the University of Islam. We were actually inspecting the university. And then out of the blue, he told me that he had been diagnosed with cancer. He had had an elevated PSA. He had already had a biopsy. And so the diagnosis was clear. So that was around 1998. Again, I don't have the records, so I can't be exact on the dates. So again, 60% African American men are about 60% more likely to develop prostate cancer than anybody else. See, there's that 60%. 3/5 of a human, yeah, 60% are over the age of 65. Diet has a lot to do with it. I don't think their advice is correct. And family history. So if you have someone in your family that had prostate cancer, then you're at a higher risk. Say if you have a brother. So Minister Farrakhan's brother, Alvin, had prostate cancer just a little bit after the minister got prostate cancer. You see? And so, it's very prevalent in families. So the minister had it, his brother had it. So now his brother is no longer with us. But may Allah be pleased with his soul. So we weren't able to give the minister's brother the same treatment that we gave to the minister. And so that shows you that had the minister not received the treatment that he did, his fate would have been the same as his brother Alvin. We didn't treat Alvin. We treated the minister. We didn't treat his brother. We weren't consulted with concerning his brother. So again, this is showing the PSA test is not such a reliable test. There's all kinds of false positives, you could say, and just because you have an elevated PSA doesn't mean you have cancer. Now, some of the latest diagnostic techniques in magnetic resonance imaging, so you can get a very, very detailed image of the prostate, and that helps to clinch the diagnosis and helps the staging to let you know the extent of spread of the tumor. So again, this is what an MRI scan gives you. Now, I'm not a good enough radiologist to read it myself, but those who are trained in that, they do a spectacular job. So starting around that time, 1998, 1999, we had to put together a treatment strategy for the minister. So the options are surgery, prostatectomy, radiation, an external beam where you're beaming a beam of radiation, seed implants, and hormonal therapy. So given all of the variables in the minister's case, we decided that surgery was out of the question. We decided that beam radiation was out of the question. Too many complications from both of those procedures. And because he was a stage 2, at that time we thought he was stage 2, then the best option was seed implantation. And so we set the course so that could be done. And part of his treatment also involved yoga, and yoga, meditation, and a technique. Let me see if I have it here. Yeah, here's the book, Dharna Healing. And it was written by my, this is my business partner, Dr. Fojenda Sinha. He and I started the Abundant Life Clinic together in 1986. I studied yoga with Dr. Sinha starting in 1984. He taught me everything that there is to know about yoga. Just before he passed away, he said, the only thing I didn't teach you was the science of dying. The science of the yoga of dying. But everything else I taught you. So that includes Hatha yoga, Raja yoga, all of the different types of yoga. So now part of Raja yoga, which is mental yoga, is something called Dharna Healing. Dr. Sinha wrote the book. Now keep in mind, he was the president of the All India Yoga Society. So he's not just one of these gurus coming out of India talking about he's some wise guru. No, he was the president of the All India Yoga Society. Now he hated to be called a yogi. He didn't like to be called a yogi, but all the yogis looked up to him. He was their teacher. And he came to America, he said, on a mission that had something to do with black people. because he said what happened to black people in America is what happened to the people in India, the black people in India. And you can see he's not one of these light-skinned Indians. So that's a whole nother subject in and of itself, about how the Aryans came into India and corrupted the Bhagavad Gita and corrupted the whole Indian society and impoverished it and enslaved it and set up a racist caste system. And so he came to America to impart a message to the original people in America who suffered the same historical fate. He introduced us to, and I'm not going to go very far in this, into the original science, the Samkhya science of the ancient Indus Valley civilization. And so you can buy this book on Amazon, Dharna Healing. I wrote the foreword in this book. I wrote the foreword. Not much of one, but it's in there with my name on it. It's on Amazon. All of his books are on Amazon, and I think you should read them. Mother Tainetta formed a friendship with Dr. Sinha because she practiced yoga. She surprised me when we were on the World Friendship Tour. She caught me doing yoga one morning, after prayer, and she said, "I didn't know you did yoga." And she told me the Honorable Elijah Muhammad used to practice yoga. And so we taught Minister Farrakhan a yoga technique called Dharna Healing. That's making use of the unconscious mind to heal yourself. And so this was before any of the seed implantations or any of the other stuff that happened. We were teaching him yoga and meditation, Dharna Healing, and these were all techniques to prepare him, for what was getting ready to take place. And I used to fly out, and Dr. Sinha used to fly out every Tuesday, every week, and spend time with the minister, teaching him yoga. Because the alternative was this. This is they have some kind of gouge machine like that to grind up the prostate gland, and all the nerves around there get destroyed. So we couldn't have that happening to the minister, especially if it was just stage 2. No, there's better options than that. And so the option that was chosen was seed implantation. Seed implantation. As you see in this enlargement, there's an instrument that is used to implant the seeds. And these are radioactive seeds, different isotopes. So they have different half-lives. So they don't last long. Some burn out within 2 weeks. Some burn out within 1 week. Some burn out within a month. Some burn out maybe 6 months. But they have a lifespan. And that's the science of what do they call it? Radiological oncology, where they figure out the exact placement of these different seeds, where it would do the most good. And so this instrument is used to guide those seeds and plant them throughout the three-dimensional structure of the prostate gland. And of course, this is done under X-ray. You can't do that with your naked eye. So the patient is actually in an X-ray scanning machine, and the oncologist is implanting the seeds, that way. So this was what we did with the minister at Howard University. Now the radiation oncologist in charge was Dr. Alfred Golson. And if you look it up, you'll see Dr. Alfred Golson and his partner, they were the pioneers in this whole technique. They invented the technique. Everybody's doing it now, but Dr. Golson and his partner, they were the originators of it. They invented the technique. They were the first ones to do it on planet Earth. And not just for prostate cancer, but for all kinds of cancer, breast cancer, all kinds of cancer. Now, unfortunately, Dr. Golson's partner died in a plane crash in Kenya. Dr. Golson was in the plane too. Dr. Golson walked away unscathed. His partner and everybody else died. And he said to me, God must have saved me for something. And maybe it was the fact that he had developed a technique that would ultimately save the life of Minister Farrakhan. So this is giving you a size, as this is a penny, and it's showing you these are tiny, tiny little seeds, about, smaller than a grain of rice. And here's the makeup of it. There's a radioactive source there. It's in a capsule and gets impregnated into the prostate. See, these are the kinds of things that Iran wants to do with a civilian nuclear program. See, they have people with prostate cancer, and they would like to do this technique, but America is trying to say to them, oh, you don't have the right to have this. So now this image may not be so clear, but you can see maybe 100 or 200 seeds implanted. This is a post-op X-ray. I think the next image is a little bit better. Yeah, you can see all of the seeds. So this is somebody probably got 300 or 400 of those little seeds implanted. See that that device is like a tube. So you might have 10 seeds all lined up, and you just push that right on in, and you have a line, of 10 seeds. And you just do that until you fill up the whole volume of the prostate gland or wherever the tumor is, because you're trying to kill the tumor cells. If you can leave some of the prostate there, hey, that's all to the good. So in the minister's case, we had to almost fill up the entire volume of the prostate. So at the time, you see, it was said later that more seeds had been planted in the minister than anybody else in the history of the world. Well, that was true. And that was true because the pioneers in the whole technique were the ones that were taking care of the minister. They were leading the way for everybody in the whole world. He had the best. He had the original. And then there was a third person, Dr. Kutravelis, who actually, you'll see, also gets credit because the second seed implantation process was done with Dr. Kutravelis' new technique. See, the problem with the first technique and that everybody was having around the world was, well, yeah, you can put the seeds where you can see it, but that gland is round and there's parts of it, wings of it, lobes of it that you cannot see. And that's why we were confused whether the minister was stage 2 or 3, because the tumor was in one of those lobes that we really couldn't see. And we really couldn't put seeds where you can't see. So Dr. Kutravelis, another doctor over in Virginia, he had developed a whole new technique of how you can visualize the entire prostate gland. So we took the minister over to Dr. Kutravelis' clinic, and we visualized it, and we saw that we had missed some of the tumor, that the minister was stage 3. We had missed some of it. So that's why he had a second procedure to cover the area that we had missed the first time. And that was that. That was that. Remember, these are bloodless procedures. They're in and out procedures. It's like going to the dentist. You're just in and out. It's just a simple procedure, painless. You might need a little pain relief, for a couple of days. You'll be a little sore there in that area. And of course, the prostate's going to be inflamed because of the radioactive seeds. But that's going to die off as the radioactivity of the seeds dies off. So generally speaking, within 6 months, hey, all the radioactivity is gone. The prostate is healed. Where the tumor was now, that's just scar tissue. And you're just going about your business now because you're cured. And that's what we had accomplished by that time. By the time of the second seed implantation, the minister was cured. There was no more prostate cancer and no more risk of prostate cancer in the future. End of story. All praise is due to Allah. Or so we thought. But here's what happened. The minister went right back to Chicago. We had him come back, I think, for, was it 4 weeks or 6 week follow-up? Probably 4 weeks. Dr. Alfred Golson, who was the top radiation oncologist, who implanted the seeds. And so the follow-up was probably about 4 weeks. So we met the minister at the Sheraton Hotel on Connecticut Avenue, Dr. Golson and I. And the minister came in, and he's looking great, feeling great, no problems, with the prostate. Everything is the way it's supposed to be. And then he told us that while he had been in Chicago, he had taken his annual checkup with his primary doctor in Chicago. And we said, "Oh, okay. How did that turn?" He said everything was fine except for the colonoscopy. You see how I'm looking right now? When Dr. Golson and I heard that the minister had a colonoscopy, you mean when the doctor put the colonoscope up your rectum and through your whole colon? Is that what you're saying, Minister Farrakhan? You let somebody do that to you? After we told you, don't allow anybody to touch that area. It's going to be red and swollen for 6 months or so. Especially in the first 6 weeks or so. So the minister had a colonoscopy done by Dr. Edwards. I don't know who Dr. Edwards is. I never met him. But Dr. Edwards, being the good doctor that he probably is, he noticed a red swollen area in the minister's rectum. Being the good doctor that he is, the competent endoscopic technician that he is, he took a biopsy. He took a bite out of that red swollen area that was just adjacent to where the seed implants had been put into the prostate gland. You say to yourself, well, why would the doctor take a biopsy of a swollen area knowing that the minister had just had seed implants? Well, that's just it. The doctor didn't know. We said, well, didn't you tell Dr. Edwards that you had just had seed implants in your prostate? Well, no, I didn't tell Dr. Edwards. So Dr. Edwards didn't know. So Dr. Edwards is just being the good doctor. Hey, here's a red swollen area. I'm supposed to take a biopsy to make sure it's not cancer. So when the ministers told us what happened, literally, Dr. Golson fell out of his chair on the floor. He fell on the floor. I didn't fall on the floor, but I almost choked to death. Because both of us knew exactly what that means. That red swollen area that Dr. Edwards saw when he was coming out with the colonoscope, that red swollen area is exactly adjacent to where the prostate gland was. And that's why it was red and swollen. Dr. Edwards didn't know, so he took a bite out of it for a biopsy. And both Dr. Golson and I knew that would never heal. That would never heal. That would never heal. And it didn't. And so that was the beginning of the disasters that all of you have heard about. The in and out of the hospital, all kinds of things. And ultimately, it was the ulcer created by that biopsy that almost killed the minister, where he almost bled out. So that's the whole story. So that's the whole story. So this is Howard University Hospitals. And so we flew the minister into Howard University Hospitals. And of course, that ulcer was still there. The bleeding had stopped. He was stable. You know what they say? Critical, is stable but critical condition. So we flew him into Howard University Hospital, right here in Washington, D.C. Everything was arranged by Dr. Massac. He was the chairman of the Department of Plastic Surgery. Here was his chief. Well, actually, he's the chief of everybody. This is the great Dr. LaSalle Lafall. Anybody that's a surgeon knows who LaSalle Lafall is. This is like the Michael Jordan of surgery, okay? Yeah, LaSalle Fall, American surgeon and former president of the American College of Surgeons. He was in charge of every surgeon in America. So I'm just showing you who was on the dream team. This is who operated on Minister Farrakhan. One of the greatest surgeons who ever lived. Look at this lady, Howard University's Dr. Deborah Ford, honored as American College of Surgeons master educator. She's the first black woman to ever be certified on the board of colorectal surgeons. And I really, want to call attention to her, because if it had not been for her, the minister wouldn't be alive. She was a part of the dream team, and we got to a part of the dissection where we literally had dissected out that ulcer. We had cut that out, which means that there was a segment of the minister's rectum that was missing, where the ulcer had been. Okay, well, that's part one. But now, how are you going to reconnect that that segment's missing now? Now you got to reconnect. That's called an anastomosis. That reconnection. Otherwise, the only alternative after that is you're going to have a colostomy. You got to come out some other kind of way. Well, Dr. LaSalle Fall's hands, and the other surgeon, Dr. Robert DeWitty, my hands, I wear size 8 gloves. All of us wear size 8 gloves. So here we down there in the minister's narrow pelvis trying to do an anastomosis. We couldn't get our hands down there. But this little lady, she wore a size 5 glove. She wore a size 5. So with her little dainty hands, she was the one that actually went down there and did the anastomosis to prevent the minister from coming out with a colostomy. So all praise is due to Allah for Dr. Deborah Ford. Otherwise it would have been a catastrophe. You see? And so that's how the minister, that was almost, you could say, it's like a second version of the near-death experience. Because that would have been a whole nother outcome if she hadn't done what she did. Now here's the background on Dr. Alfred Golson. As I told you, he was the pioneer in seed implantation. And here's some of his research. I mean, look up his name on the internet. You'll see he's written hundreds of papers on all of this. This is the top guy. This is the top guy that designed the program for the minister, and that's why it was a cure. Between him and Dr. Kutravelis, it was a cure. These are the research papers from Dr. Golson. And there's many, many more. And here's Dr. Kutravelis. Can I blow that up? Yeah, that's Dr. Kutravelis. And it was his technique that allowed us to see the minister's entire prostate gland so we could put the seeds in it to cure it. Thank God for Dr. Kutravelis. He's a very wonderful man. Greek, obviously. And like most Greek people, they're very nice people. So that's an ugly picture of the kind of ulcer that we were dealing with. A bloody, nasty, infected ulcer. From just the location where it is in the body. It's got to be infected. And then eventually, it was almost like hemorrhoids. Just worse. Think about hemorrhoids on steroids, because that's about the same area where the ulcer was. So all of those hemorrhoidal veins, that sometimes, you get a little blood on your toilet tissue. Well, that's exactly where that ulcer was. So as soon as that ulcer eroded into one of these blood vessels, hey, that's where all the blood came from. And that's also where Dr. Ford had to go down and perform that anastomosis later on. That was a miracle. See, it was something like that. So there she is. So you ought to keep her in your prayers, because she saved your minister's life. And And see, so now that's Dr. Masak and I. This was right after that surgery. We had walked out. That's the operating room. Wait a minute, the recovery room right behind us. We had just put the minister in the recovery room, and we walked out, and somebody took a picture. And so, may Allah be pleased with his soul. He just passed away a week ago, and so that's why I'm doing what I'm doing, because the minister's still alive. See, now a lot of people don't give me credit, or they don't know. Well, how see the terrible thing about people not knowing what happened is that they don't know who to show gratitude to. They don't know who to show gratitude, and being ingrateful or ungrateful is one of the worst sins that there could be. Ingratitude. But if you don't even know, how could you even be grateful? Because you just don't even know. And so people should be grateful to everybody that was involved. I don't know the name of that nurse in that ICU, never got a name. But you should be grateful to her. You should be grateful to Dr. Masak. You should be grateful to Dr. Robert DeWitty, to Deborah Ford, to LaSalle LaFall. They saved your minister's life. You really should be grateful to me. You don't have to be, but you should be if you're a decent human being. But how can you be decent if you don't even know what happened? So now you do. So now you know why the minister's still with us. Because we saved his life. And Allah blessed us to save his life. And even if you or no one wants to give credit to where credit is due, we know who the giver of credit is, and that's Allah himself. So I just quote the Quran. He who saves a life, it is as though he saved the lives of all men. All praise is due to Allah. So I am come that you might have life and have life more abundantly. You see, I mean, that's what I've been doing for 51 years. In 2005, the atonement and purification of a nation. See, I don't even know where that tape set is. Did that at Mount Mariam, you see, where I introduced a new paradigm in healing. So you need to get that. And if you get a copy of it, send me a copy, because I don't have a copy. But it was done in Mount Mariam. And this is the new technique, autonomic response testing. Now, we didn't use this on the minister. I didn't know this technique at that time, but now I do. And so I would be able to do greater things than was done at that time. But we did what we knew at that time. But greater things have been gained since then. And that's my wife there that I'm examining. May Allah be pleased with her soul. And so I'll end as I began. You see, how would things be different if we had our own hospital? We wouldn't have questions about what happened to the Honorable Elijah Muhammad. We wouldn't have questions about what happened to Mother Tainetta Muhammad. We wouldn't have questions about what happened to Brother Rasul, what happened to this one, what happened to Brother Jabril, what happened, to all of the believers that have passed away, especially in the last few years. What happened to Sister Ava? Could we have saved her if we had our own hospital, if we had our own institutions? I would say yes. We probably could have saved all of them. We probably could have saved all of them, because what is the best ingredient in a healing prescription? What is the number one ingredient that must be there to make any prescription work? Compassion, love. It's my love that heals, you see, along with my skill and knowledge. But without the compassion, the knowledge doesn't work, the skill doesn't work, except sometimes. But it's love that makes it work every time. And so if we ever develop enough self-love, then we'll build not just a ministry of health with hospitals and clinics all over the country. I mean, how many hospitals do the Catholics have? How many hospitals do the Jews have? How many hospitals do the Baptists have? The Seventh-day Adventists, how many hospitals do they have? So how many should we have, to fulfill the needs of our people? And if we had a hospital, even just one, you see, think of the people who are not with us now, who probably, Allah willing, hey, they would still be here. But we still have the minister with us. So all praise is due to Allah. I'm just doing what I always have done. I just try to give you the facts. And don't forget about the 19th element. And I don't think I meant to include this, but that's okay. And there's prayer and fasting, so be with us Sundays and Mondays. I'm there with prayer and fasting Sundays and Mondays at 9 a.m. Of course, prayer and fasting is a group online, on Zoom, on Facebook, sometimes on YouTube. And that's what they do, pray and fast and help one another to achieve spiritual goals. So you don't want to miss that. So thank you for being with me with these 2 episodes. What happened to Minister Farrakhan? And so now you know. And now I would just say that in the ensuing 1 or 2 years after that major surgery, which launched the commission, that's what I got busy with, I lost, I won't say I lost contact. No, the minister told me that the family did not like me. And so therefore, they started to sideline me out of the loop, you could say, of the minister's care. And even though for a long time I persisted, ultimately, I realized, that I was no longer in a position to have much to say or do concerning the minister's care. And so other people have taken over since that time. And so I don't have any information or details about what has happened to the minister since that time. And so you would have to inquire from others what the current situation is and what happened in the intervening period since my involvement ended. So I just wanted to make that clear. I can only give you part of the story as to what happened, but what happened after my involvement ended, you would have to get that from other people. So thank you for being with us. Thank you for your time and attention. And I hope that this helped to satisfy, some longing in your heart for a better understanding of what really just did happen. And that it will help you to make sense out of things a little bit better than before. So thank you very much. May Allah bless and keep you. May He grant us success and prosperity and ultimate victory over the disbelieving people. Assalamu alaikum.